It never gets old hearing Republicans say, I think the American people agree with us, when all the polling data, all the polls say that is not the case. People did not vote for this. You're betraying the effort and the labor of Americans who work their entire lives. So Republicans are really doubling, tripling, quadrupling down on the fact that they want to deport all of our migrant workers and then replace them with sick and poor people on Medicaid to make them work for, earn their health insurance. I mean, we went from justifying slavery, where farmers are owners of migrant workers, to this in just a couple of beats. I've been playing this clip of Brooke Rollins, which I may play later. We'll see how we get there. But John Thune, the do nothing other than be a politician his entire adult life, who's now a millionaire. I don't know how that happens when you only make $175,000 a year and have to maintain 2 residences. How's that, John Thune? How'd you pull that off, brother? He is agreeing with Brooke Rollins, the Agriculture Secretary, about forcing poor and sick and elderly people into the fields in order that they earn their health insurance through Medicaid. Throwing around a bunch of loose nonsense propaganda numbers about the able-bodied people on Medicaid, which makes up a tiny fraction of Medicaid. And those people typically are caretakers for people who cannot work, who need 24/7 round-the-clock care to ensure that they survive, that they live. Here's John Thune, the new Mitch McConnell. We picked a doozy. We always pick a doozy. Here he is backing up the play of Brooke Rollins, justifying this asinine idea that our poorest, our sickest, our oldest should be the ones picking the crops in the absence of the mass deported migrant workers.
So Brooke Rollins says that the 34 million able-bodied adults that may now no longer be eligible for Medicaid because they can work and they only have to work 20 hours a week is a very small, I think, number of hours to ask for. Here she is talking about where those workers could go.
When you think about, there are 34 million able-bodied adults in our Medicaid program. There are plenty of workers in America. Mass deportations continue, but in a strategic and intentional way.
So let me ask you this with regard to immigration. The president the other day said no amnesty. That's not going to happen. He said it's going to be work programs. We're going to have a work arrangement. So is this the moment, now that the big, beautiful bill is passed, what are you planning to take on next? And a work program would have to go through Congress and be approved, correct?
Well, I mean, I think there are things that we can do to create, obviously we've got workforce crisis in this country. And as she pointed out, we have a lot of people, able-bodied adults who, are on programs. And frankly, again, one of the things that we said as a result of the legislation that we passed last week is there ought to be some reasonable expectation that people who are getting benefits through government programs are at least attempting to find jobs. And there are jobs out there, as she points out. There's certainly a lot of work in the ag sector of our economy. But I think the American people, Martha, agree with us that when it comes to government programs, when they're taking money out of the economy, out of the pockets of hardworking Americans, sending it to Washington, D.C., there ought to be a reasonable expectation that you're going to do your best to root out fraud, waste, and abuse, that you're going to do your best to ensure that there are work requirements and that there aren't people who are benefiting from these programs who aren't eligible for them, like illegal immigrants, like other people who should be working. Those are all, I think, reasonable reforms that make these programs fiscally stronger and more sustainable for the long term so they can continue to deliver the benefits for whom they were intended.
Yeah.
And that's what this is all about.
It never gets old hearing Republicans say, I think the American people agree with us, he says, when all the polling data, all the polls say that is not the case, that your big, beautiful bill, John Thune, was more unpopular coming out of the Senate than it was coming out of the House. And that is saying something, because people did not want this. People did not vote for this. You're betraying the effort and the labor of Americans who work their entire lives. You're betraying the ethos of the richest nation on the earth to take care of its most vulnerable. Medicaid is not a program that has just tens of millions of able-bodied, normal, able-to-work people. Like they're just a bunch of mid-20s folks down in their basements playing the video games. That's not what it is. It's to ensure that our most vulnerable have the ability to get health care, the ability to eat, the ability to live their lives with dignity. And they're acting as though it's some kind of an unemployment program. And of course, Martha MacCallum there editorializing as a Fox News anchor, as a news person, that, well, I don't think it's that big of a deal to ask for this minimum amount of work requirement. Not saying that obviously the intent of work requirements is to throw up barriers so people don't get on the program. That if you don't check a certain box or mark a certain form the correct way, you're off. It's cruelty for cruelty's sake. It's also an abdication of their role as both an elected official and a constitutionally protected journalist, that they didn't give you the full width and breadth of the comment, of the quote, of the clip of Agriculture Secretary Brooke Rollins. Luckily, there are individuals who work in this business in independent media who will give you the full context. Here is the full context from what Brooke Rollins said.
But I can't underscore enough, there will be no amnesty. The mass deportations continue, but in a strategic way, and we move the workforce towards automation and 100% American participation, which again, with 34 million people, able-bodied adults on Medicaid, we should be able to do that fairly quickly. Thank you.
And we move toward automation, which is to eliminate human effort in labor. But until we get to a totally automated system, we're going to get our sick people, our poor people, our old people out there, because they're going to, your grandma's in an assisted living facility? No matter, get her out there. There's strawberries to be picked. We've eliminated our traditionally misused and abused labor force in migrant labor. So now we're going to turn that abuse upon our own. The sick, the poor, the elderly. And Republicans are out here doing the rounds in the media, justifying it, trying to convince Republicans who watch Fox News, this is the new path forward. We must do this. And you got Dr. Oz out there acting as though you got to do your patriotic duty so you don't cost the government money in health care. We're the only industrialized, advanced nation. We're the richest nation in the world. And the only one that doesn't guarantee health care to its citizens. Another embarrassment, another blight upon the reputation of the United States. And listen, there's even like middle of the road corporate moderate Democrats, Republicans in deed, in action, there's only in name they call themselves Democrats, who are opposed to Medicare for all, who are opposed to universal health care, because we can't afford it. For some reason, we can't afford it when Great Britain affords it, Germany affords it, Canada affords it. All of our less rich partners globally, they can afford it. It hasn't bankrupted them, yet we can't. What do you think? A lot to unpack here. You can comment below. You can also call, leave me a fewer than 3-minute voicemail on the voicemail line, 714-576-4054. And of course, as always, you can email me daily@dollemore.com. I sure do appreciate you. And if you feel the same way, you want to help support this work financially, $2 a month is what it takes. You can go click the join button below, see what's involved to become a channel member. You can also go over to patreon.com/IDoubtItPodcast. If I was to get a scant single-digit percentage of people to give $2 a month to support this work, we could fundamentally grow this operation into something much, much different, more impactful, and I need your help for that. Anyway, follow me on social media if that's your flavor of communication. Also, I am at Dollemore just about everywhere. I would love to see you there, and I will see you next time. Be genuine. Take care of one another.